would you say is the most satisfying thing that you find about your work? And how do you maintain that satisfaction or passion on a daily basis?
This career is quite difficult because you face death in every day. I remember an advice from my grandmother saying that you cannot cure all people, but if you can be somehow empathetic with them, if you can listen to them, they will be very happy, even though they already know they are not going to be cured. So I try to be very empathetic with my patients, helping them in many ways. As I already mentioned, with my team, we like to change some things. I think that if we can share to the world our experience from the clinical point of view or from basic point of view, it's important because we maybe see different things from if we compare to other big countries that could have all things to do research. And also, now I'm the Chief Academic Officer at my institution. So with the experience that I got when I was younger, I try to support all kinds of students. It doesn't matter what gender they are, but I try to support them. So I always told them, well, maybe you need to knock a lot of doors, trying to have an opportunity, and some of them will never be open, but maybe one or two could be open. So you need to be prepared and you need to be trustful and confident.
Who do you think has supported you in your career, and how did they support you to make you believe this was possible and have such a successful career?
I think that looking into my life, it's not just one person, it's been different persons, but obviously there are some that stay all the time, like family. For us, it's very important to have stronger family ties. I think that's the most important thing that happened to me. It doesn't matter if I'm older or younger, my brothers, my mothers, they are always there, trying to support me in every way. Some patients also support me. I remember when I was a second year resident and I was so tired. It was 3 a.m. at morning and the patient told me, hey, why don't you sit here next to me to my bed when I wake up? And I saw that the patient put me a blanket. So it was so nice to see that also patients support physicians, because we never say about how people see us. And in the other way, I can tell you that I got a lot of very nice colleagues helping me. One of them was Fabrice André in 2004 that I finished my fellowship. I remember that I was waiting for him after he finished his talk during ASCO. I just got close to him, asking what advice he can give me to do some fellowship outside of Mexico. And it took me 3 years, but I went to Gustave Roussy and it was a great opportunity for me. I did the same with Luis Diaz from Memorial Sloan Kettering, and he also gave me the opportunity to be there. And I think that I'm very lucky to have different points of view how to treat patients from European and American perspective. That helped me to do a better job here with not only with my patients, but also with my fellows, trying to push them to see more about the world, to see how things goes outside of Mexico.
Is there any career decision you look back on that was difficult? And tell me why it was difficult and maybe what you learned from it.
I remember that after I did the fellowship at Gustave Roussy on breast cancer, I returned to Mexico. Then I got this spot at NCI Mexico, but when I did the interview, the CEO told me that it was not possible to have a spot on breast cancer department. The only spot available was GI. So it was a very tough decision to say if I take it or not. But at the same time, I'm a very positive person. On GI, there is not so much that have been done as on breast in Mexico. So I thought it was a great opportunity to change some things. And after being a GI oncologist in the past 15 years, I'm so happy that I took that decision that in the beginning was very difficult.
how would you describe your career, the top highlights, and maybe your top 3 songs to go with it?
About the career, well, I'm a very lucky person because I like what I do. I do it with passion, and I'm a very enthusiastic person. So even though that some doors do not open, on grants or awards, it doesn't matter. We need to push. We need that things change for patients and for ourselves too. So as a woman, I have faced a lot of things, but it doesn't matter that sometimes could be very hard. We need to keep on. And my 3 favorite songs, well, it's a very difficult question because I love music, but I can tell you that one of those is Feeling Good from Nina Simone.
Thank you, Erika. Thank you for sharing your journey and your insights with us, and we look forward to seeing you again.
Thank you for your big effort trying to change things. And thank you also to ESMO Women for Oncology for this kindly invitation.